Good morning. My name is Eric Weller. I work here at South Central College, and I also coordinate the Healthcare Coalition for South Central Minnesota. Joining me this morning are representatives from area hospitals, clinics, businesses, school districts, and other public agencies and public health. We're here this morning to talk to you about the flu and the large volumes of patients, specifically influenza patients, and those that are having flu-like symptoms that we have seen in our region. The number and diversity of people gathered here this morning should indicate the severity of the flu here in the south central part of the state, as well as the interest of all of us in doing what we can do to prevent the further spread of this illness. We have a number of speakers this morning. They will be very brief in their comments, we hope. And then at the end, we will open it up to questions from you, the media, and also some of our other business partners as well. So the first speaker this morning I'd like to introduce is Dr. Greg Kuchar. Dr. Kuchar is the CEO of the Mayo Health System here in the Southwest region. Dr. Kuchar.
Thank you, Eric. Good morning, everybody. I'm glad to see you all here and really looking forward to particularly the questions as we get to that part. As Eric said, we are seeing in our region patient volumes and patient acuity levels, that is the sickness level of these patients, greater than the peak of the H1N1 flu epidemic that we had about 3 years ago. Inpatient volumes are up. The number of patients presenting at clinics and urgent care settings and phone calls is up, and the number of employees calling in sick is up. The current flu outbreak in our region impacts us all as individuals, as parents, as employers, as healthcare professionals, as educators, and this is not just a healthcare concern, this is a community and a regional concern. That's why we're all here today. We all have the interest, the opportunity, and the responsibility to take this situation very serious and do everything we can to prevent further spread of influenza and other like illnesses. So to help establish that, today we are announcing that every hospital in our region, a total of 15 hospitals in the 11-county area, is implementing visitor restrictions. This unprecedented step is one way to make sure that the flu situation in our region doesn't get any worse. It's important to note that all healthcare facilities in our region, those of us who are in the part of the Mayo Clinic Health System and all others, are working together to collaborate and coordinate policies, procedures, and messages. Over the last several years, we have worked together to coordinate strategic efforts in preparation for a natural or human-caused disaster or crisis. And over the last several months, we have worked together to coordinate flu prevention, planning, and response efforts in our area. So I'm grateful for the cooperation and collaboration and pledge that as Mayo Clinic Health System, we'll do everything we can along with everyone else in the community as we work and deal with this crisis. Thank you very much.
Thank you, Dr. Kuchar. Now I'd like to introduce Brad Krier, who is an epidemiologist with the Minnesota Department of Health.
Thank you, Eric, and thanks everybody for coming. The word must have got out that I was wearing a tie. However, I had to get up early, so my wife wasn't there to check. I don't know if it matches, but we'll just go with it. But yes, a tie, so obviously full house for that. So yeah, I am here. I'm an epidemiologist with the Minnesota Department of Health, and I'm just here to talk about kind of what we're seeing here in the area, so some statistics, and then a little bit of information about the vaccine. So first of all, so far to date, we've had over 900 hospitalized cases here in the state of Minnesota. Here in the South Central region, we've seen a higher rate of cases, so we haven't seen a higher total number of cases, but with the regions, we've had the highest rate, about 19 per 100,000. To compare that, the metros had about 12 per 100,000. Now again, total numbers we've seen lower, but when you're basing that on the actual population, we've seen a higher rate here in the state. Other areas are starting to catch up. They're starting to see cases, so we're not the only areas seeing cases. However, the South Central does have the highest rate thus far. One of the best ways, obviously, to combat the flu is to get the flu shot. And I know you're going to hear that from everybody up here, but again, it's not too late to get the flu shot. It's very important to get the flu shot. Now, one of the things that we do here with the flu shot is a couple things. One is always, because they pick 3 different strains. They pick 2 A strains and a B strain each year, and then that's what the vaccine has. And the question is always, what we're seeing in people. Is that the same virus? Is it the same strain that we're seeing in that vaccine? And again, that can change over time pretty quickly, but based on what we've seen, it is a very good match this year. Based on the numbers, about 91% of the totals that they've looked at have been the actual strain that's in the vaccine. If you break that down a little bit more, here in Minnesota, we're seeing mainly H3 cases, which is an influenza A case. If you look at your influenza A cases, it's 99% match. So it is pretty much the same vaccine, same strain that we're seeing in the vaccine. The reason that it's a little bit lower, down to 91%, there's 2 circulating B strains and only 1 in the vaccine. So we are seeing some, that's about 70% of the B strains that we're seeing. Sorry, it gets a little complicated, but 70% of the B strains that we're seeing have been in the vaccine, so about 30% are not a match. And again, we haven't seen much B around here, so again, that's just kind of overall. And they are going to add, some vaccines will add a second B strain next year for the next flu season, but we don't have that right now. I also want to talk a little bit about how well the vaccine works. And again, this is very complicated stuff, so I'm going to try to keep it as simple as possible. But basically, the vaccine efficacy, no vaccine is 100% effective. And some are better than others, but even with a good match, so even if we are matching the same strains, studies show that the vaccine is about 60% effective in healthy adults. Some studies have shown higher in younger children, and certain other age groups, maybe up to 80%. But again, again, not 100%. Now, some people might say, well, that's a reason that not to get the flu vaccine. It's pointless if it's only 60% effective. Well, it's actually quite the opposite. It's actually showing that you have a 60% chance of protection versus a 0% chance of protection if you don't get that vaccine. Now, again, I'm not a betting man, but if I were, I would take the odds of having a 60% chance versus a 0% chance. So again, I guess the message is get vaccinated. It's not too late. Don't gamble with your health and get vaccinated. Thank you very much.
Thanks, Brad. As we said, this is many partners, hospitals and clinics coming together to give the message today. So now I'd like to introduce Dr. Julie Gerndt, who is the medical director for the Mankato Clinic. Dr. Gerndt.
Thank you, Eric. We have clearly seen an increase in the number of patients that are in need of services. In the past week, we have seen about 500 patients more than we did a year ago, and overall about a 40% increase in requester services through our urgent care and express clinic systems. We are also seeing an increase in the number of patients who are willing to accept the flu vaccine, including some patients who previously declined to accept it. We've had to redirect clinic services, staffing, both among the physician and advanced practice provider staff and our regular clinic staff, to set up backup systems for staffing, so we are ensuring that we've got providers available to take care of patients even if we have some staff that are staying at home because they're ill.
Thank you, Dr. Gerndt. Now I'd like to introduce Dr. Ruth Bolton, who is an urgent care physician at the Mayo Clinic Health System here in Mankato.
Thank you. Mainly it's the same story, same thing going on with us. In our urgent care, we have literally doubled our numbers just in the last month. It really happened just mid-December, and it's been we've been having long waits, and we've been sharing back and forth between us and Mankato Clinic. And what's been interesting is that the patients are starting to get educated now, and they're coming in earlier looking for medications because they've heard that you can get the Tamiflu if you can get it within the first 48 hours, but they don't really fall into some of the protocols. So we just started we had a family medicine meeting this morning, and we're going to start a triage protocol so that we can help folks realize when they should come in, when they shouldn't come in. Obviously, anyone who's infectious is better off at home than in the public, so we're trying to do a stronger triage right now. Our flu clinics are wide open, and everyone's coming in. Still takes about 2 weeks for once you get immunized in order for it to take. But it's been working. Interestingly, in the urgent care that we've been seeing, it's not the little children that have been ill. Their immunizations are a great take. I appreciate the 80% because it's really the adults that have been ill, and it's with or without the vaccines. But they're still always been better off with the vaccine. So we agree with what's been said, and we've been working very hard trying to keep everybody healthy here in the South Central state.
Let me just, I think it might be worthwhile to go back and talk just a little bit about practical, what happens with the flu virus, how does it develop, what's the time frame, and just a little bit about the practical pieces of that. So it's a virus, it's a very tiny particle. It's spread primarily by respiratory droplets. So those are actually the larger particles. When you cough, it doesn't float around in the air like very tiny particles like some other infectious agents. It actually, it's close-up droplets or droplets that get on surfaces. So covering cough and a lot of hand cleaning is really important as far as preventing spread. So that's the first thing. The second thing is that it has a fairly short incubation period. It's only a couple, 3 days from exposure to the time that you develop illness. It's not very long. So there's not a long incubation phase. And people are infectious from about the day before they get sick or about the time they get sick. That means with cough, fever, chills, body aches, sort of those standard influenza symptoms. And that's going to vary a little bit how long that lasts, but somewhere from a few days, a week to 10 days is kind of the typical illness. And as far as being careful for spreading, people should not go to school, not go to work, quite honestly, if they're able to spread the illness, and you can sort of tell that by the fever and the cough. So that's a little bit about the science. As far as the who should get the there is medication, antiviral medication. Tamiflu is the most common one, but there's others. The CDC recommendations are that we should be giving that to young children or people basically under 2 and people over 65. They're at more risk for the complications that can occur with the flu, and that's what we worry about, pneumonias and other types of bacterial illnesses and things that come on top of that. So people in those age groups should be given antiviral medications in the first 48 hours of symptoms. After that, it's very questionable how well that's going to work. Other patients would be those that already have other illnesses, say they have ongoing asthma or chronic obstructive lung disease like emphysema, they're immunosuppressed on prednisone or something like that for other illnesses. Those are the kinds of folks that also should be given the antivirals. For other healthy people, and this is really key, you really don't need to go into the clinic. You don't need to go to urgent care or a doctor, and quite honestly, you're spreading it around while you do that. And for those folks, we'd actually prefer that you stay at home. And so clinics, Mankato Clinic, and us and others are developing those systems so that you can call in if you have questions. And for folks that maybe fall in those age groups, some of those can get their antivirals over the phone, so you don't have to come in. So we're trying to develop those symptoms. The question about who should come in is basically, yes, complications can occur in healthy people, and basically you'd have to look for very high fevers that are not going away, shortness of breath that's getting worse. You just feel very sick. Those are the kinds of folks that should come in and be checked. And obviously, if there's a question, do that, but we don't think that everyone with the virus should be coming in. That's really not helping themselves or helping other folks as well. Those are sort of the key sort of points, I think, that I'd like to make. Ruth, is there anything else that you would say, or Julie? All right, thank you.
Thank you. Now I'd like to introduce Sherry Luer, who is the Director of the Waseca County Public Health. Sherry.
Thank you, Eric. I'm here to represent the local public health community in South Central Minnesota. The entire population of the state of Minnesota is served by local public health, and it's our main job to keep our populations healthy. We keep our finger on the pulse of our populations, and we have noticed an increase in ILI, or influenza-like illness, in our population. My main goal this morning is to bring to you the message of how best to stop the spread of influenza in both our region and in the state. The public health message is a simple one. Number one, I will say it again, get vaccinated. We not only get vaccinated to protect ourselves and our family, we get vaccinated to protect those around us who are unable to get the vaccine due to perhaps a pre-existing health condition. The second public health message and you've heard it before, is cover your cough. Cover that cough with a tissue or with the crook of your arm. Wash those hands often. That's the number 3 simple public health message. Wash your hands well and wash them often. If you're unable to be by a sink and wash those hands long enough, use hand sanitizer. And lastly, please, we implore you to stay home when you are sick. Whether you are at work, whether you are at school, whether you're planning an outing on the weekend, we in public health are asking you all to do your part in helping stop the spread of influenza in the South Central region, as well as the entire state of Minnesota. Thank you.
Thank you, Sherry. Now I'd like to introduce Phil Claussen, who is the Director of Human Services for Blue Earth County. Phil.
Thank you. My comments, I think, will just complement what Sherry just offered. From a public health mission, we have a communication mission, a prevention mission, a couple of structural components to that mission. One is in the room here, up at the table, that we look at creating community partnerships that are strong, the networking that's necessary to bring a clear and concise message to the public. And so that's obviously part of our mission even today, as it's represented here in all of these folks that are coming together. The public-private partnership and the holistic response and approach to these issues, we believe makes a huge difference in how we can move forward. So that's one element. Underneath that is an appeal to the public as well. The goal of getting ahead of this surge, we certainly will do our best. It's part of our job and our mission to do that, but we are interested in cutting this surge off. And to do that, we want to get the word out. And we really need, beyond the professional folks that get paid to look at this intervention, we want to appeal to family members, to those, each of us, that have either issues ourselves that need to be brought into the picture, or especially family members from special populations. And I just want to finally emphasize those groups. And the early intervention that we need, especially as we go to those people, our neighbors, our friends, and especially our family, it's important to emphasize those populations, the young, so the under 5, but then the very young, that also was emphasized through some of the use of the vaccine, under 2. And then the elderly population, a group that we serve in public health through assisted livings, nursing homes, any kind of long-term care facilities. Usually part of that population is there's more vulnerability and risk. And so if you have friends and family that you know have some of those vulnerabilities, that we just want to emphasize that. And finally, any medically complex conditions, people that have coexisting disorders of diabetes, heart disease, any kind of internal organ problems, the flu would obviously make a hard situation even worse. And so the real appeal for my piece here is to make sure that if we have people we know that need to be told that they need to get the proper medical care, that we're just imploring people to do that. Thank you.
Thank you, Phil. Now I'd like to introduce Barb Embacher. She is the Vice President of Greater Mankato Growth, which is our chamber and economic development arm here in the Greater Mankato area.
Well, as you've heard, many people have been affected by the flu in our region, and businesses are seeing increased cases of absenteeism and an outbreak of more sick calls and absenteeism in their workplace. Not only for themselves, but also due to children that are ill. So I think it's important that we encourage employers to do their part in making sure that they take steps to help their employees deal with this. We know that employees are a critical resource, and there's especially small businesses sometimes can't do without just one person. So we have to be careful of that. But primarily, there are some steps that employers can do to help with this issue. We want to encourage, first of all, for employees to stay home that are ill. Maybe there's some policies that can be lightened up a bit. So thinking about some of our human resources policies that may require an employee to bring back a doctor's note if they're gone from work more than a few days. That is just adding to the issue of our healthcare providers who are trying to treat patients and adding one more thing that they don't have a lot of time to deal with right now. So if you can consider lightening up on some of those things as a business, that would be helpful. Other suggestions are maybe to be flexible with some telecommuting options, people to work from home if technology allows that. We also want to make sure our businesses are promoting good personal hygiene at the workplace, providing hand sanitizer, encouraging hand washing, maybe even requiring the cleaning of surfaces like desks and telephones and computer keyboards would be helpful during this kind of a moment. And last but not least, please encourage your employees to get a flu shot. There are a lot of communication that you can do within your workplace to make that available, advertise where they can get that, and all of those kind of things that businesses can just encourage their employees to do. I think I'm just repeating some of what you've already heard from others, but businesses are certainly at risk for the same kinds of things and want to do their part to help reduce these issues. Thank you.
Thank you, Barb. And finally, I'd like to introduce Sherry Allen. Sherry is the Superintendent of Schools for the Mankato.
Good morning. I am here to just share with you some of the school trends that we're seeing. We actually had a spike in absences a couple weeks before winter break. That was also true with staff. What we're seeing right now, keep in mind, we're just back after a few days of some time off. If we have not seen a spike in our absences at this point, as I check with our health services team, we will see, as we've been told, what brings tomorrow, Friday. But we do have some very strong practices in place, and you've heard those things already. But we really do emphasize to our families healthy habits. With that hand washing, covering the cough, also, if possible, getting that flu vaccination. As you know, within the wellness plans that we have within our school districts and in our communities, it's also about healthy habits, getting plenty of rest, healthy foods, making sure physically active, and eating nutritious foods. And when you start to come down with those symptoms, that you are staying home, because the goal is to get everybody healthy and keep people healthy. And so I can't say enough about our health services department and what we're doing as a team to make sure that we keep those practices in place. Thank you.
Thank you, Sherry. Before we open up to questions, I have a few final comments here. Every person in our area has the ability to make a difference during this flu season. There are things we can do right now to significantly reduce the number of cases and that need treatment or hospitalization, and you've heard those numerous times today. But I am extremely confident in our collective ability as a region, as a partnership, as a healthcare coalition, that we can take care of this issue and other issues that come forward. The other thing I draw your attention to, for those of you from business and industry, local public health, and others, in the back of the room you see our flu cards. They're in packs of 50. Please take some of those for your staff and others as you go on. And then last but not least, I would like to thank Kevin Burns. Kevin is the PIO for the Mayo Clinic Health System and part of our healthcare coalition, and is acting as that as we ramp up our incident command structure. And Kevin really put this news conference together, and so I appreciate his time and efforts in doing that. And with that, I will open it up to questions. If you've got a specific question or who to direct it to, or we'll try to get it to the right person up to the microphone. Bill.
Brad Krier, could I ask you a quick question?
Sure.
Quickly to explain why do we see, as an epidemiologist, maybe you can explain this, why do we see this outbreak more severe in these south central counties than elsewhere across the state? What is it that makes that unique?
I kind of assumed I would get this question. There's really no way to tell. You know, it's just one of those things where we're seeing increased cases here. It might have been that there was somebody who traveled. You know, it's very difficult to tell. And you know, it is a communicable disease. It spreads from person to person. You know, we don't really have any differences in vaccination rates or anything like that. I think, you know, I guess luck of the draw is probably not the correct term, but it is just kind of a chance thing. And we are seeing, you know, basically the rest of Minnesota catch up as well. And you can also say, you know, if you look at, you know, North Dakota or South Dakota or things like that, their rates and their numbers don't seem to be as high as well. So it might be that people aren't seeking care. You know, there's a number of different possible explanations, but really to give one is pretty much impossible. So
follow up to that.
Sure.
I mean, how does this region compare to the rest of Minnesota? You say the rest is catching up. I mean, what is
sure.
what is the comparison?
So like I said, we have the highest rate per 100,000, which is 19 per 100,000. The Metro is the second highest with about 12 per 100,000. So again, and then it kind of varies. And it is on the website, the actual numbers of that. And then they get announced every Thursday with the rest of the statistics. So it is quite a bit higher, but again, as time is going on, they're starting to even out a little bit more.
And then to follow up that, what makes this year's strain seem to be more, I mean, it's probably hard to tell.
Sure.
It's more virulent. It seems to be spreading quicker or getting through the vaccines.
Sure, and again, those are looking at hospitalized numbers. So when you're looking at hospitalized numbers, the predominant strain that we're seeing is the H3 strain or H3N2. In general, those tend to be more severe years. It tends to affect the elderly a little bit more, whereas the H1N1 numbers, which the pandemic strain was, tends to affect the younger kids. And again, those who are elderly are more likely to have, they are a high-risk group, so they're more likely to be hospitalized, more likely to have those secondary infections and things like that. So that tends to be why we're seeing, increased hospitalizations and things like that. Just looking at numbers, the numbers aren't released yet, but we've seen over 325 for the first week of January, week 1. To put that in comparison, when we were looking at the height of the pandemic, H1N1 2009, we had about 450 was the most hospitalizations we had per week. So we are catching up to that, even though this is just a seasonal strain of influenza. And it could be because it's that H3 strain tends to be more severe.
This question may be more directed at Dr. Kuchar, but can you kind of explain to us what kind of a strain this has put on the healthcare system in general? You mentioned unprecedented steps with all these clinics and hospitals coming together. What I guess has the effect been on either staff or care you're able to provide? Kind of talk about that.
Great question. I think, as you might imagine, and I might have some other folks comment too, volumes are up. Clinics are very, very busy. It pushes other appointments back, so people are waiting much longer. So that happened in urgent care. It's happening in regular offices. A lot of folks are going to the emergency department, which really we'd rather not have that. That's really like to keep those out of there, but there's not other options. So it's really just on the volume. It's put a strain. Early on, there are things like supplies, the testing kit. Early on in the epidemic, you don't know for sure, so there's a lot of testing that goes on. We're really not doing much of that anymore because we know what this is. Those supplies have run low, but I don't think that really makes much difference. The other thing is that a lot of providers get sick too. And of course, when they get sick, working is really not a good thing. So we've had to deal with shortages of staff. So it's been staff, it's been the flow in through the clinics, and then putting together some of these systems so we can try to take care of these things over the phone. That's not all that easy to do, but I think we've made great progress with that. The other comment I'll make is that that's something I think we're all learning from. How do we do this? Because there's many other situations where being able to put in these procedures into place is a good thing. So there's a silver lining in this is I think the way we're responding is improved because of the work that's been done regionally, of what we went through with H1. We've learned as a region how to do this. Some of us go way back to the meningitis incidents we had around 95, 96, and as a region we came together and responded to that quite well. I think we do it much better today given the experience that we have working together as a team, Eric and others, bringing together the whole community. So that's like I say, that's the silver lining of this situation. Does that answer your question?
I'd ask Dr. Gurn to comment to that, but one other comment that Dr. Kuchar talked about. When we talk about our healthcare coalition, it's really 11 counties and 15 hospitals that come together. It's the Mayo Health System, it's Independence, it's the Alina system have hospitals within us, and it's really working together. It doesn't matter what the geographic regions are and coming together, and then our clinic partners, Mankato Clinic and others, it's really, as Dr. Kuchar said, working together. And this coalition that we have has been going on since 2002. Dr. Gurn?
I can echo some of the things that Eric and Dr. Kuchar have already said. We've had a series of phone conferences to talk about how we will work together to meet the needs of our patients. We've had to develop backup systems to ensure that we have staff available, so we have primary care providers that usually would not be scheduled in urgent care opening up time to focus on the patients that have flu-like symptoms. We've had to do the same with our staffing and with nurses that are available to answer questions by telephone. So when the right thing to do is to encourage somebody to stay at home and not expose other people, we're able to do that. But we built on the plan from H1N1, pulled that out, dusted it off, took what we knew worked, and then revised some things that we thought we could do better.
Dr. Kutcher, maybe you can answer this. In terms of past experience with putting these types of restrictions on visitors in hospitals in place, is there, a pretty good sound evidence, or is this basically just you're playing the numbers game? The fewer visitors you have in a hospital, less likely you are for the spread. Or is there some hard evidence that shows it really does control the spread of contagion?
I could tell you I absolutely know that answer, but I would be making that up. There might be others that know. Kathleen, do you know, is there evidence?
Actually, it's just a part of CDC strategies to prevent the spread.
It's been done in other hospitals.
Yeah, so it's sort of one of those best practice issues. Is there absolute science behind it? Probably not that much direct, other than the fact that the studies are amazing on understanding the droplet size and how long it can stay on surfaces. And certainly from understanding how it spreads pretty rapidly in through a community. So I don't think it's without some evidence, but there's certainly a fair amount of consensus that comes around these types of recommendations. The other point I will just make, if you go to the CDC website and look at what it's doing nationally, it's widespread in at least 41 states, as I recall. I just looked a couple days ago. I think that Hawaii has sporadic. That's about the only one that was sporadic, and Guam had none. But other than that, my guess is that we're just seeing it right now because it's a time frame. I think this sort of spreads like waves. So this is pretty much a national phenomenon.
Rob, real quickly.
Go ahead, Bill.
Advice about hand washing. I mean, people are washing their hands so often that they're getting dry skin. Seriously, what can you do to
public health
wash your
response?
hands frequently, but battle that dry skin?
Well, we do recommend that people use lotion because we've gotten that too. Excessive use of hand sanitizers as well can cause that drying, and it's winter in Minnesota. We are fighting the dry skin anyway. You're exactly right. Wash the hands, but then use a good hand lotion in between to keep the moisture. And the other thing, let's keep our hands cleaner in the first place. I think most parents are always telling your children, don't touch that, don't touch that. I think my kids have been hearing that more often than ever. We need to keep our hands away from our eyes and our mouth, that sort of thing. Don't be touching stuff. But little cracked skin versus washing hands, I urge you to keep washing them. And don't forget to sing your ABCs while doing so to make sure you're washing long enough.
Rob.
Yeah, I had a question about Tamiflu. We're hearing stories about a wide variety of, I guess, a big variation in who gets it. Is there any kind of protocol in place to maybe standardize who gets Tamiflu? Because we're hearing from parents and saying kids are getting it, people my age are getting it.
It's a great question.
From what you've said, it seems like it shouldn't be getting out that much.
We have totally taken this over, and I've given everyone, at least in our family medicine department at the Mayo Clinic Health System, a copy of the Minnesota Department of Health references the CDC's recommendations for use of the Tamiflu. Tamiflu is not a penicillin that, we love to see a strep come in, we treat it and they're better and everybody's happy and everybody's happy in 24 hours. Tamiflu doesn't work like that. We want it to, and so it's kind of a wannabe drug, but I tell everybody I'd get the Nobel Prize, if I could really treat a virus. And so Tamiflu is available, and it's the one that we're really using because it goes down to 1 year old, and they've even had some recommendations for using it less than 1 year. But the recommendations globally for CDC, which we really need to do, and I think most people are trying so hard to participate in, is if the children are less than 2, treat them. Just treat them. Little guys get sick and they crash fast. And we want to get our young ones taken care of aggressively. If they're over 65, the same story. And then there's a lot of exceptions that for anyone in between 2 and 65, if they have any health compromise. It would be diabetics, it would be renal failure, it would be people that are on cancer chemotherapy, certain agents of medications that they're using, AIDS patients, certainly people with immunocompromise, you want to treat them and be much more aggressive with them. There's Native Americans and Eskimos, somehow their genetic predisposition sets them up for more complications, and so we treat them if they have that background. We just treat people that are taking chronic aspirin, which is not very common anymore, but we're treating them because there's a risk of a thing called Reye syndrome. So there's a whole list of things that we physicians in children. And we're very familiar with it, I think. But what's happening is, as providers, we want to fix you. And so we want to give you the medication. Patients want to get it, and then we have this lovely, TV to patient advertising that is out there that's telling everybody to get in within 48 hours. And that's been our problem, is that now people are getting educated, but they're coming in and then we're telling them no. And then it spends their money, their time, and again our time. And I've had 100% of my urgent care providers down with this stuff. And as I said, I can't tell whether it's really just a bad cold or whether we've got the influenza too. But everybody gets sick when everybody comes in. So we're trying to treat correctly, but there are true protocols, and I think everyone here in the community knows what they are. And the hardest part is when Aunt Millie got it, why can't I get it? And again, it's not as good as it seems. It's not a cheap drug. The pharmacies can get it, but they're not keeping high quantities on board because the shelf life isn't very long, and they don't want to be stuck with it if all of a sudden everybody's had their share of influenza and we're done for the year. But it's accessible, it's available. But I've heard different costs from different pharmacies on it, but it's definitely well over $100 if you have no insurance to cover some of that, and so that makes a difference. There's side effects with the Tamiflu, mostly nausea, that make it, what's the trade-off? So lots of things to consider with this.
At the end of the day, though, it's up to the doctor to decide.
The doctors are deciding, and we're all over the map on that. That's why we were having meetings with our family physicians today, so that they don't play us against each other, that we're all in this together and mom and dad are doing the right things. Yes.
What is the cost for just an influenza shot? And is that a deterrent for people coming in?
No, the influenza shot has been very available and at pharmacies, at our clinics, everywhere. That the shot hasn't been the cost. The Tamiflu cost is, we've heard, from about $110 to $140, depending on which pharmacy you go to, is the downstroke on that prescription, and it's 10, it's either 5 days of treatment if you have the influenza, or it's 10 days of treatment if you're doing it preventatively.
Question.
Two of the 5 statewide deaths have been teenagers. You talked about younger people and older people. Are teenagers particularly vulnerable?
I've been watching that. I've been fascinated by that. I've been watching it here because of the college students, and we see it when we first start seeing, when you talk about public health, what we observe in urgent care is that when we start the school year in Labor Day or whatever, the high school kids have either gastroenteritis or a respiratory disease, and the college kids have the opposite, and then they swap it out about halfway through the year. And I don't know if that's different because we maybe have more kids that live at home, or is that why I'm just throwing some ideas out. But I think the college kids and the younger kids, I don't think they care for themselves. I don't think they identify it for what it is right away. I don't think they fess up that they're sick because they got some big ball game, or they're wrestling, and if they tell somebody they're sick, they can't do it. And I don't know specifically these 2 specific cases, but when I see the teenagers, I think it's just that they think they have a cold and they're fine, and they don't tell everybody they can hardly breathe. And I think it's just a matter of education like crazy, and parenting as well as you can.
What is it about this flu that kills people? Respiratory? They can't breathe?
It's respiratory. It's all respiratory that gets them. Mm-hmm.
Did you guys say how many cases have been hospitalized in Mankato? Come
on. We just have the region, and last count, I believe, was last week's. It'll come out tomorrow with the actual totals. But I think last week's was 53 total in the region hospitalized last week. So we don't have total.
We know what they are in Mankato?
And that would be, I guess, from the clinics. We don't have county-specific or city-specific data at all. They haven't been.
Sorry, I don't know, actually.
We can get that for you, Rob.
And then I also wanted to clarify with the younger kids, when we do look at deaths, 90% of the deaths historically in seasonal influenza are 65 plus, and the majority are 80 plus. So we're seeing it's relatively rare to see these younger people have it. Generally, they have underlying conditions if you're under 65, and we see deaths. There are, of course, some occasions where we see these deaths that are in, children who, or younger people who are under 65 who don't have underlying conditions. And again, they're relatively rare, but it is, anybody is susceptible to secondary infections, staph infections, pneumonias, anything like that. So it's just, they're more likely if they have those high-risk individuals, So the fact that we've heard about, 2 that are younger, I think that might just be reported a little bit quicker. We still, we have to follow up quite extensively, especially in these, 80-plus-year-olds to see, was it actually influenza, was it something else? So I think our numbers will increase, and if you look nationwide, they say anywhere, sorry, I gotta find my numbers here. So anywhere between 3,000 and 49,000 deaths a year, depending on the season and everything. CDC says statewide, or not statewide, nationwide. Sorry about that. So to clarify, so we do see deaths. It is a fatal disease. Again, relatively rare when we see it in these young kids, but when we do, it's big news. So.
Brad, I'm not asking you to look into a crystal ball, but based on past experience, when will this end? When will we?
I can say, influenza season in the Northern Hemisphere runs from October to usually around May. That doesn't mean that we don't see cases after that. It's just that's when our season is, and then so it's usually the winter months. We don't know exactly if it's colder, drier, what that is. We don't, there's not specific evidence to show that. But you can say eventually it will end. Where is the peak? When will it end? Historically, the last couple of years have been pretty mild. If you take out the pandemic year, but our peaks have usually been in late January, early February, sometimes even later February. So that's historically the last couple of years, but historically it can be pretty much any time between that October and April or May, but generally later on in the year as it spreads and builds up. It's a communicable disease, so 1 to 2 to 4, so it can spread like that. So.
The demand, maybe this is up your alley too, the demand for the flu vaccine's gone up drastically in the last week or 2. Any concerns about supply keeping up?
No. I don't know if anybody has more detail.
Let me just emphasize a couple of things. I can't say enough about the partnership that is exhibited here in the room with healthcare, business leaders, long-term care, school districts, public health, and government officials. This is not a healthcare issue. This is a community issue throughout our region. We've got resources for businesses and schools in the back of the room. All hospitals in the region are handing to patients and visitors a note explaining the hospital visitor restrictions and encouraging them to help us with this. So our appeal is not only to the general public, but to patients and their family members. Help us take better care of you by helping us understand that visitor restrictions means everyone, all areas of the hospital. That means the inpatient units, that means waiting areas. We don't want people who feel that they have to come into the emergency department to pack up the station wagon full of the family and bring them along with. That's not going to help you, and it's not going to help us provide the optimal care. So we're asking patients and their family members to also assist us in enforcing not only hospital visitor restrictions, but being safe and doing the right things. This is about the community and the regional response. No entity represented here in this room can do this alone. We have to do this in a partnership. And we've had a lot of experience with Eric's leadership and others. In 2009 for H1N1, this coalition, many of the people you see here before you, held the largest single immunization event in the history of the state of Minnesota. We know how to do this. We know how to respond. This is a serious situation, and that's why we're all coming together.
Any other questions? Go ahead, Rob.
If people have already had the flu, are you still recommending they get a shot if they have a shot?
Want to take that one?
Oh, go ahead.
Shots are always good. It's a quick answer. We're always recommending it because it's going to cover Yeah, because there's more than one strain, and hopefully you won't get the A and the B in one season, but it makes no sense not to get it in the shots work.
We will make people available to the news media after this. If you have additional questions or comments or you need further information, we'd be happy to do that. I know some of you are on deadlines. But again, I want to thank everybody. I want to thank our partners for coming, and thank you for our colleagues in the media for getting this message out. As Kevin said, this is an issue that all of us need to work together. Thank you.